Hello. Hi, everyone.
Hello. How's your daughter, Dr. Abuse?
Hello, Sudha. Hi, Monica. Hi, Samson, Korat. Nice to see you all. I'll just wait for a couple of minutes to join. Okay. Can you hear me?
Sure.
Okay.
Yeah. Hi, Doc.
Hi, Monica. Okay. Let me just try. Okay, sounds like it's only you. So that's fine. I'm gonna start with talking about the portfolio and how to fill your portfolio and like have it's really a chat today, to see how far have you approached it, in your portfolio and what you've done so far. So the main thing, when you start in the NHS or you become a doctor is you want to be able to have a portfolio. The portfolio means you need to collect all the data and information you have gained through your training in order to show it either later when you apply for like higher jobs or for other jobs or for yourself as well, to be able to see what have you progressed, so it's like a documentation of what you've done so far, and that will help you in the future, as I said, in your applications or in your like reflection of what you've done. So in every stage there is a different portfolio. So for example, your stage now working as, like SHOs, because you're most of you are non-trainees, uh, so some of you will be in, we always compare you to the training program. So some of you will be in the stage of like F2. No one is going to be in F1. We always choose your training, or your stage to be either F2 or IMT 1 or 2, depending on how you progressed and also your background, what have you achieved before coming to the NHS or to England. So, and for example, if you just graduated from your country and you've done 1 year of rotation, as similar to the foundation year we do here, and then you haven't done anything else, hopefully when you come to the UK, your grade will be either F2 or late F1 or early F2. And why I'm saying you still at F1, because some of the skills doctors here in the UK, which they achieve at F1, can be slightly different than what you can achieve in your country. I know in most of our countries overseas, I'm from overseas as well, you don't have a specific program. They might just give you the chance to go and rotate in gynecology, pediatrics, like surgery, medicine, so all the major specialties in the hospital. But you don't have a specific role. Here, people will have also a curriculum, and they have to follow this curriculum in order to fulfill all the criteria to be an F1 or competent F1 doctor. They still will go into the rotations and everything, but in each rotation, they have to submit a certain amount of cases they have seen. Can be very simple cases. It's not like complicated as when you get more trained or you become more senior. And the main thing in the F1 year is to reflect. So they always ask them to reflect about every stage they have done. Like if they have put a catheter, they reflect about what happened in the catheter, what difficulty they have. Did they find a helpful doctor to help them? They find a nurse who can supervise them. Whether a problem communicating with a patient, there any like aseptic technique. So all these things around the procedures, which usually when you are performing it later on, you never think of it. But as an F1 doctor, for example, here in the UK, they have to fulfill this reflection because it will help them in the future to know the difficulties they faced and how they overcome this difficulty. Um, so, as I said, like for example, when I was back home, I never ask a patient for a consent when I'm putting a catheter. I just think, okay, this is something simple. You're just gonna put a catheter, and there is no need to ask for consent. Similar to putting a cannula, for example. I want to put a cannula. Why do I need to go and tell the patient, oh, I'm gonna put this cannula for you now because I'm gonna give you some antibiotics, fluids, and which arm is better for you? Is this painful or not? Um, have you tried this before? And get a consent from her, because in your back mind you think, oh, this is important for the patient. I have to put that because it's a job. I've been told to do it, and I don't need to really have a conversation with the patient just to put a cannula or put a catheter. But and I know that this happens anyway here, and no one actually takes a consent for putting maybe a catheter. You might take a bit of a consent, but for a cannula, you don't take a consent. You just tell them, oh, I've been told to put a cannula in you. But ideally, if you want to do it professionally, you must speak to the patient, get a little bit of rapport with the patient, and get some confidence so they trust you, because sometimes even the fear can make the veins, like get shrunken, and then they become very small. You can't put the cannula in. So just ask, obviously politely, and try to explain why you're doing this. So anyway, so I mean, in general, this is mainly F1 foundation year, and this is how they fill their portfolio. Every step they do, every conversation they make with a patient, with a consultant, with their colleagues, with the nurses, they have to reflect on everything. So after this stage, you comes the F2 stage, which is more, you become more senior, you become more confident, you're able to do stuff which is slightly higher in the rank, about like thinking, have a good thinking process. You can have your own differential diagnosis. You can act on your differential. You can start ordering bloods on your own and ordering investigations. You have your decision plan, and you can obviously initiate also the plan of management. So this is how you progress in from foundation year 1 to foundation year 2. So you can feel the difference now between F1 and F2. That's why when I say when you come here, it doesn't mean because you've done your rotations in back home that you are suitable to do an F2, because you didn't have this like period of communication or getting used to the system and being able to reflect on all your actions. So you might need this little bit of training on that in the beginning. And after that, you can carry on with doing what we're going to say about the F1 training, sorry, F2 training or IMT. So the other level for people who are more trained in their countries, they have already done like 2 or 3 years of training. Your level would be equal to like either IMT1 or IMT2. I'm just talking mainly about medicine, as you know, because we're medics here. Um, and with this kind of training, you need to be more initiative. You need to have your own vision. You need to have your own plan of management, and then you build up on this and try to collect the portfolio, proper portfolio. And in this scenario, your portfolio is going to be curriculum based portfolio, which is already been made and discussed, and people had, like a lot of time to discuss the curriculum in order to produce what's best for the training in this stage. So that's why it's very good to follow a curriculum rather than inventing your own curriculum. You can't really go and say, I want to be more efficient in cardiology. So I'll see all the patients with chest pain, patients with heart failure, patients with arrhythmia, and then you don't see patients with hepatosplenomegaly or patients with abdomen, patients with headache, because you prefer this system and you want to be good in this system because that's your ultimate plan and you want to be a cardiologist. So this is what the faculties or the deanery has now, like, I mean, collected all the information, and they found if in order for you to be good in a specialty, you need to be good in all specialties and all like parts of medicine. So you can build up all your information when you see a patient with heart failure, for example, because patient with a heart failure, he already has ischemic heart disease, he has COPD, he has stroke, he had all other, like risk factors. So how can you judge this patient or make a proper diagnosis and management if you don't actually know what else he has or the other issues or medical issues he suffered from? Uh, Hence, we have to follow the proper curriculum. All right, so you can't really pick and choose from a curriculum. And with any curriculum of clinical cases, there are also some emergency cases which we have to follow. Okay, let me just show you my screen so we can have a better understanding of what's... Can you all see my screen?
Yes.
Yes.
Good. So I just logged in on my portfolio, and I will try to pick someone from my trainees and look at the portfolio they have. Right. So the hospital here, or University Hospital of Birmingham, they give you the option of having a portfolio, which is a crap portfolio. Sorry to say that, but the reason I'm saying it's a crap because it doesn't have a curriculum. Okay. So what I was talking about from the curriculum point of view is not present. Okay. So I'm just gonna pick anyone. Let's choose Samiha. And there's nothing there, okay? So if you want to see a curriculum of the Denary, it's going to be completely different. And the reason I'm showing you this, so you can tell the difference between this curriculum and the other curriculum. So in this curriculum, if you just click here on the curriculum, there is nothing. It says no, the trainee is not following any curriculum. All right. But they have only the option to submit your forms. So you click on forms and then you go under all forms here. Okay. And then you can choose some forms. For example, you want to have assessment forms. Okay. Sorry. You would choose something called CBD. It's not coming, sorry. Available forms. Sorry. Yeah. So let's choose this CBD. Actually, they have improved it a little bit. If we choose CBD, CBD means clinical-based discussion. So, for example, you have seen a patient in the ward round, and this patient you prepared, you presented to the consultant, and now you want to like write this patient and keep it as on your portfolio. So, as I said, you want to keep a track of all your cases and prove that you've seen certain types of like chest pain, abdomen pain, headaches, whatever. So if you click on here on the clinical based discussion, and then you type, the date when you saw the patient, the title of the clinical event, like it was, for example, acute admission or ward round, and then you put a brief history to the patient you've seen and your reflection, and you choose, some of the clinical setting problems and whatever. When you finish all of that, you send it to your consultant for assessment, and the consultant will reflect on this patient or this case, you've sent them. So this is what we call CBD. So CBD means you have seen a patient and you discussed it with the consultant already, you have made a plan, and now you want to prove that this patient reflects one part of the curriculum which you have to do. Okay. The other thing which has a clinical application is something called mini KICS, mini clinical evaluation exercise. In this case, what you need to do is you have to ask the consultant to see you while you are reviewing the patient yourself. So the consultant shouldn't like see the patient with you in the beginning. You go and, for example, you clerk the patient and then you present the patient to the consultant and then tell the consultant your differential diagnosis, plan of management, investigations done, and your interpretation of the investigation. So this means I'm just, like observing what you've done and making sure that, your plans and of management and everything is right. And that's what you need to do for any case similar to that. Okay. So this is called mini kicks. The third thing you need, you can send, to the consultant is the DOPS. So the DOPS is the procedures. If you have done a procedure, you can record it here as well, like you've done a lumbar puncture, you've done aesthetic tab, pleural tab, whatever, and then you create also a ticket. You send it to the consultant for proving that you've done it, but the person who supervises you is the one who should reflect on this DOPS. I mean, you can't ask the registrar or a nurse or whatever to supervise you and then get the consultant to reflect on this DOPS for you. It has to be the one who supervised you. And in your stage, if you have a senior SHO or a registrar or a consultant, any of them can supervise a procedure for you. Anyone who's already competent with a procedure can supervise someone who's incompetent. Okay. So these are all the CBDs, mini kexes, and DOPSes. I'm not sure if they have included ACATs here. Yeah, there's no ACAT. Right. The ACAT is similar to the CBD, but it's more number of patients. So, for example, if you have seen, if you are on call and clerking a few patients, you've seen 5 or 6 patients, you can ask and they have been post taken by one consultant, has to be the same person. You can send the consultant something called ACAT. So it's a group of patients seen by one consultant, and the consultant will also give you the feedback about your performance with these cases. It's always better to do an ACAT because it collects more number of patients, and it's easier to send, and then you can link these cases after that to your curriculum. So even that, to be honest, they have increased the number of things which you can submit here. Before, they didn't have all these kind of submissions, but there is no curriculum. You can link all of that to it, okay? If you have a curriculum from the deanery, which you can buy something called service portfolio, you can buy from the Royal College of Physicians, depending on your stage. So, for example, if you want to buy an IMT2 curriculum or IMT3, I think the cost is not that much. It might be just £160, and we can give you that as a study leave, part of your study leave. And with that, you will have a curriculum. So I will show you the difference so you can understand the difference between the curriculum and no curriculum. Right, so if we go under curriculum here and then we choose, I think she's one of the new trainees. Okay. Okay. Sorry. Right, so you can see the difference now. So once I clicked on the curriculum, we have a curriculum here. And under the curriculum, you have four main things, or 5. Common competencies is the one you gain, for every patient, like the NHS ethics, the clinical events, reflection, teaching, all that stuff. Okay, patient safety. So all that non-clinical stuff which is associated with the with any case. And that gets filled already from seeing clinical cases, so you can get that done in as parallel to the presentations themselves. If you do the emergency presentation, so these are the essential four cases you have to do for in every rotation: the CPR, shocked patient, unconscious patient, and anaphylactic shock. Okay. In these 4 cases, you have to make sure that you have seen a case or two and connected that to this part of the curriculum. So the emergency presentations, you have to fill it 100%. Okay, if you are like IMT 1, 2, 3, and each stage you have to make sure you have filled all these 4 emergency presentations, because they represent what we call like acute unwell patient. So these acute unwell patients is the one which we want to see how you can perform, or how can you manage these very sick patients. All right. And then you have the top presentations, which would be the common medical presentations in medicine. For example, acute kidney injury, abdo pain, back pain, breathlessness, collapse, so chest pain, everything we see, you know, on daily basis. You have to make sure that you can link, you know, 2 or 3 cases to this part of the curriculum. You can see here the CBD, ACAT, mini kicks, reflection, anything you can do, you just link it to one of these presentations. In that important presentations, you have to fill, or the top presentations, you have to fill at least 80% of them. Okay. Then if we go to, so these are nearly about 20 presentations, the top presentations in medicine. If we go to the other important,
Also, I would say,
yeah,
I think they don't have any more on the IMT portfolio. They're not based on the presentations anymore. They don't have it on the new one.
yeah, I know. I'm just trying to show a curriculum, how the curriculum, you know, works. Not this. I know this is very old. This is CMT.
I see.
I'm just trying to show how can you have a curriculum and how can you have a non-curriculum which has been offered by UHB. Okay. So the other important presentations are, you know, things which we don't see commonly or not on a day-to-day basis, like abdomass, swelling, aggressive behavior, alcohol, actually you see a lot, anxiety, so all that stuff. Right. After this, we do the procedures, and the procedures, you have essential procedures which you have to fulfill in your first year, like the pacing, which this you can get in the ALS, ascetic tap, lumbar puncture, pleural aspiration, or tap. And these are the essential which you have to prove that you are competent in them. The essential, but they come later on in the training, are the ascetic drain and the chest drain, and putting also a chest drain either in pneumothorax or in pleural effusion. Right. So, I mean, in general, this is a curriculum, how the curriculum looks like. Whatever your stage is, IMT 1, 2, 3, I think with the IMT 1 and 2, you have to put also more reflections and to see your competency level and also the another level. I have the curriculum for you. I can show you that now. Just a second. Right, so this is the curriculum for the IMT. In the first 2 years, there are mandatory things or rotations you have to do: the acute medicine, acute take outpatients, geriatrics, ITU, HDU, and simulation. And then in year 3, it's between 6 months in acute medicine and 6 months in the specialty you think you're gonna do, or you have to do some ITU as well on that. Let's get the curriculum here. So they have these CIPs, which are things to prove that you understand, you know, things. It's similar to what was in the CMT I showed you in the beginning, the important information. So also the behavior, ethics, all that stuff, communication. They only change, you know, some titles, but it's the same thing. safety and quality, how to become a clinical teacher, and then with the internal medicine, especially when you do the acute medicine, how to manage an unselected take. And then depends on the specialty, you just, reflect on each specialty. So for every case you have to submit, you just put this CBGs, which has some domains. It's a lot of things, but I mean, it's all in the curriculum. So it depends, as I said, what you want to do. If you want to apply for medicine later and become an IMT, I would suggest buy one of these curriculums and make it as a service curriculum, and then you should be able to understand the curriculum. So when you get the job, it will not be difficult for you to fulfill this curriculum later on. Okay, are you all with me, or any questions so far?
No, we're with you. It's clear so far.
Say again? Okay.
It's clear so far.
Okay,
Yeah.
so clear. Right, I will send you a copy of this PDF file because it's quite big. You just need to go through all what they want, from the curriculum. And at the end of the day, you just have to submit the cases, and as I said, reflect on it and make sure you do a case in each scenario or each presentation, and try to link them with the curriculum. Right. I will try. I did promise you many times that we will have these skills sorted under ultrasound guidance. I can't really get the clinical skills lab till now. I've tried so far, but it was a bit difficult. But I might just, as we suggested last time with Khalid, we can just get the mannequin and try to train 5 people at every week, just on one skill, either the pleural aspiration or central line or whatever, because I mean, the course was including everything here, like the chest drain, ascetic drain, central line, all by ultrasound. So I have mannequins, and the mannequin allow me to use the ultrasound on them. So they are ultrasound modified. You can see as if you have fluid, and then you're able to also insert the needles and see what you're doing by ultrasound. So it gives you a lot of training, and hopefully when you do the actual procedure, you feel more confident. So we'll try to organize it like that, do some simulations. Once we finish the teaching, hopefully we can start doing some simulation. Right. In order also to fulfill your portfolio, you have to do an audit or a QIP. The QIP, as you know, is more important than audit now, because it includes the audit in the beginning, and then after that you produce an algorithm or a plan of management for certain skills, or you've seen something wrong, for example, like people when they do lumbar puncture, you go to the procedure room, and then you find the needle in one place, the bottles in the dirty room or whatever, or the clinical room, and then you find the pressure manometer in another room. So I think someone did this audit before, that's why I'm describing it. So obviously got a survey from the trainees, if it was hard for them to do the procedure, and obviously to just collect all the material and the equipment takes them about 10 to 15 minutes. So after that he did, made a back, and this is what we're using now. So he made a back which has all the bits and pieces of the lumbar puncture in one place. And this back is obviously easier to use because you just go and pick it, and then you bring only the local anesthetic and the gloves from outside. So that was a QIP. So QIP means you want to improve a service or a skill or anything you can see which is deficient. There was one quip which I really liked once, before people used the diabetics. When you offer them food, you don't ask them what you want, or you don't actually look at how many calories they have to eat. And they just bring them normal food, as other patients. So I think one of the trainees as well has made a proper calorie calculation for every food which is always presented in the hospital. They always bring, fish and chips, or like some minced meat, all that stuff, So he calculated the calories in each meal, and he gave that to to the like the lunch lady, or the lady who presents the lunch, and she gave it to every patient so they can choose which one has less calories if they are diabetics, and which one has less sugar, and all that stuff. We don't have that. This is a good quip if someone want to adopt that as well. Right. So I mean, you have to present that. So I said teaching, quip. If you have done any incident form, or you've been involved in a complaint or anything, you can reflect on that as well. And then you put on finally in the portfolio all the exams you passed, all the courses you've done, all that stuff. And obviously all that will be discussed with your supervisor during the meetings. You should have minimum of 3 meetings with your supervisor. Initial meeting in the beginning to go through your portfolio and what's your personal development plan and what you want to achieve. And then after that, you do your, you talk about your aspirations, what you want to do, and all of that. And then he should tell you also your job plan. That's in the initial meeting, and show you how to fill also this portfolio. The second meeting, it depends if you spend, because most of you spend with us about a year. You should have actually more than 3 meetings, but if we try at least to stick to the 3 meetings, that should be enough. At least the mid meeting, they will go through what you have achieved so far, your progression, if you need any help, if you have any problems, any conflicts, any stuff like that. And the third meeting should be the end of your rotation meeting. And that should include everything you've done. You should prepare for it beforehand, and make sure you have submitted all your DOPSs, all your CBDs. So everything you have done in the past, in order to make your portfolio look really good. Okay. If you are a trainee and you haven't actually filled your portfolio, the supervisor can refuse to sign it off for you, and then you'll not be able to go to your ARCP. So do you know what ARCP means? Anyone knows?
No. No.
So ARCP is the end of rotation assessment. I can't remember what ARCP stands for now, but I'm not sure. Khalid, is Khalid here? Khalid, tell us what ARCP is.
Hello.
Yeah, do you know what ARCP stands for?
It's the annual review for competencies and progression.
Oh, okay. Are you
So
sure?
it's
We're just making
not
it up
important to
now.
be said. No, it is like that. Yeah. It is and
Okay,
progression or progression, something like that, but it's annual review for competency progression.
that's fine. Excellent. You have passed through a lot of ARCPs, I guess.
Yeah, I did.
I think it's like the most scary day of the year because
It is the most scary month, to be fair, because it's more scary before the day.
right. Okay, so this is the portfolio for, like, let's say service people, dinnery. For the dinnery, this is a mandatory thing. It's not optional. For people who are non-trainees, as I said, you can do it as a service thing, which would help you in the future to when you apply to your proper training, to get the portfolio right. All right, so this is regarding the portfolio. I'm just going to talk a little bit about the appraisal, which is slightly similar and different in the same time. So the appraisal is just appraisal, the definition of the appraisal itself, it's an act of assessing something or someone. So still similar to the portfolio, like you have done some actions or you've taken cases, you've seen things and you want to reflect on them. But in the appraisal, it's done once a year. It's done with someone who's competent to assess you. And to be an appraiser with an R at the end, you have to go through proper training. So for me, I am an appraiser. I have to spend like 2 or 3 days just to be an appraiser, because I have to go through a lot of documents, understand how to appraise someone, how to give them, advice and all that stuff. It's slightly, scary a little bit, similar to the ARCP, but in the same time, it gives you more push, I would say, and helps you in your career. Because even for consultants, we have to go for appraisal. I mean, it's for everyone. Everyone should have an appraisal. It's not only for juniors. So even we finish now the portfolio and ARCPs and all that stuff. Now we have to go for the appraisal. The benefits of the appraisal, it allows, this was like a comment from one of the doctors. He said, it allows me to stand back from my work, think about how can I improve and how can I improve what I am doing, okay? It can also help you to look back at your achievements, challenges, lessons you learned, and reviewing past year personal development plan objectives. So you put in the beginning your personal development plan, and you want to achieve, for example, I want to be by the end of the year the best teacher. I want to be the best one who does lumbar punctures. I want to, finish all my portfolio, and I want to apply for a training post. So all of that, we have a lot of dreams. You put that in the beginning, but you never know if you're going to achieve it or not, okay? So you always have big dreams, and these dreams sometimes are unachievable. So in order to do a proper BDB, you have to follow what we call the SMART thinking, which it has to be, something simple. And I think I lost my memory, guys. I don't know why. I can't really remember the abbreviations. Something measurable, and A is accessible, I think, and T
So,
is related to time.
yeah, A achievable,
Achievable, measurable, and then the
R
other,
realistic,
yeah, realistic, yes, and T
and then
time,
T
time
time.
related, yeah.
Time bound. Oh, yes.
Yeah. So if I think of becoming, you start, as I said, like as in the beginning of F2, and at the end of the F2, you want to be an IMT and you want to apply for the job. So that's your main personal development plan. But also in the back of your mind, you like teaching, you like doing quip, you like to do a lot of skills, you like to do many things, that you want to be very good in ultrasound and all that stuff. But do you think in your mind that you can achieve all of this while doing your also normal day-to-day job, like having your normal life and family visits, holidays, you want to study for the exam for MRCP or whatever. So obviously you have so many things in your mind, but what's your priority? What's your main dream? So let's say your main dream is to become an IMT trainee, because this is going to be your future and your career. So I would put that as your personal development plan, and I work around it, rather than putting, all the other things you want to do. The other things can be delayed and you can do it later on. But put that as your just one plan. You don't need to have 2 or 3 plans. One is enough. Okay. But to be honest, in order to achieve, for example, if you want to be an IMT trainee, you must do some teaching, you must do an audit, you must do the CPDs. So that will include a lot of the things you're thinking about, but you have to tailor the things you are thinking about with your plan. Okay, so it has to be achievable. That's the main thing. Then the other thing in the appraisal is aspirations. Aspirations are slightly different than personal development plan. Like I'll give you an example for me. My aspiration was to be to work with a charity, like organizations, and go and become I don't know how to say it, like the most accessible doctor in the whole world, and travel to poor countries and help people in poor countries and become a lifesaver, really. So obviously my aspirations now are different than when I was in your age. In your age, I just want to finish my career and then get my house and like get some money or whatever. But now I'm thinking of other things which are it depends on your stage in life and your age and what you have achieved before and what's your new aspiration. Okay, so always have this aspiration, because this is something you might not achieve or you might achieve, but if you can do it, it's well and good, will make you feel happy. So I've done actually my aspiration in 2018. I went to the Rohingya and I did help the people there in Bangladesh. So that was my aspiration, which I feel very satisfied doing that, even if I don't do it again, but at least I've done it at some point. But I've always have this in the back of my mind. I thought when I wanted to be a doctor, I always wanted to help people everywhere. Right. Okay. So have always big dreams.
That was very, very wonderful. That's great. One day we will do it as well. One day.
Okay. That's fine. Right. So how to fill the appraisal. So the appraisal, by the way, regarding who needs to do an appraisal. So everyone who's non-trainee, like non-dentary doctors, you have to do an appraisal. So actually all of you here sitting with me here, you have to do your appraisal. This is your mandatory thing more than the portfolio. So the portfolio is more for your training and for applying for jobs and stuff like that. But the appraisal is like, as I said, it's an assessment of your performance over the year. And at the end of this appraisal, if you don't pass your appraisal, then you will not be able to move to another job elsewhere. If you want to continue, for example, doing this, what we call like trust grade job or non-training job, you have to do the appraisal. Okay. So in the appraisal, it's, there is the appraisal link on the desktop for every computer in the hospital, called Medic at Appraisal, which you can just, if you go through it, I've just picked the main top points you can fill in it. It's very easy and signposted, as they say. First, you have to just submit your personal, information and training grade and all of this. And after that, you have to fill the CPDs. So CPDs here are similar to what we talked about in the portfolio. So it can include also the cases you've seen and everything, but it will not be called external CPDs. So in CPDs, you have two parts, external and internal. Okay. The external are the ones which you do outside the hospital, or you can do them online, because now they allow, the online teaching. So you have to go for a proper conference and get the external CPDs. You need to collect about 50 CPDs in the year, and each hour will equal to one CPD. So for example, if you go to 2-day conference and you attend about 6 or 7 hours, in the day, so that's about 14 CBDs. And then you do that like 2 or 3 times in the year. So you nearly fulfilled your CBDs. You can do internal CBDs as well, which can be counted with the external. And this is more or less, what you do with the patients, attending MDTs, attending complaints, mortality and morbidity, grand round, reading, journals, and writing papers. So all that stuff you can use as your internal CBDs. The online CBDs also are, as I said, they are counted now. I just want to show you, because sometimes, people cannot attend, the CBDs or the conferences. So I'm just going to give you something really cheap you can do. Sorry, guys. Right, this website, I don't know if you all know it or not, called ELF H Hub. Have you seen this website before? Can you see the screen?
Yes.
Okay. No, Khalid, I know you know it, but the juniors, anyone knows this
No,
website?
no, I'm saying yes that I can see
Oh,
the
yeah,
screen.
yeah. Sorry. Thank you.
No, it's all right.
ELF H Hub. Anyone has been on it before?
Yeah, I use that as well.
Okay, good, Chai. Right, so let's go from the beginning. I'll show you how you can log in it. So when you log, I logged on it because I have this Open Athens thing. You need to get that first from the library. Okay, so you go to the library, they give you that immediately. Everyone in the hospital who works in the hospital can get this Open Athens. And this Open Athens is very, very helpful because it helps you to access any journal. The trust has links with all journals like BMJ, New England Journal, American Society of Nephrology, American Heart Association, whatever, all the journals all over the world, they have access to them, which if you get this Open Athens, you will have the same access like the trust, and it's a free access. So you can access any journal, and then you're able to, after that, join this ELF H Hub, which has mainly the acute medicine modules and some other modules, which I will show you now. So after you log in, they added this coronavirus thing, and then they have the acute medicine, Acumen. They have the ultrasound. If you are interested in learning the ultrasound, you need to do this famous online first. And then after that, you learn to do the logbook and you do it. And there are some also like leadership and management skills on this website. And there is emergency medicine. There is the leadership, blood transfusion, intensive care. With this leadership, module, you can actually gain a BG grade, and you can apply for masters after that. So it's like one of the steps to get a diploma and then masters. It's very good. It takes about 40 hours. So if someone interested in leadership, but it's free here, so that's why it's very good. If you go on acute medicine, so it gives you all the top presentations, okay? And each presentation, if I go on any presentation, let's say cough, so gives me the case, and then you watch a video. And after you watch the video, then gives you an exam to do. And when you pass the exam, then you get a CBD. And this depends on how, like this takes 30 minutes. So this is going to be 0.5 CBD. Okay. But then if you do all these 20, presentations, you can get up to maybe 30 CBDs or whatever. So it's a very good if you're able really to do all the modules here. As I said, you can do also the leadership skills or the management, and then you can achieve all these certificates, and these are all accredited certificates and well known. Okay, you can get proper CBDs with them. Right, that's one thing. And as I said, it's free of charge. The BMJ, I think all of you know the BMJ and the BMJ learning. Anyone is registered on the BMJ?
Yes.
Okay. So the BMJ also, I think you pay a small amount of money for the trainees. I don't know, to be honest, how much you need to pay. Anyone knows?
There's some modules for free on it. I
Okay,
don't think you have to pay.
so not
Others
all of
are,
it paid. You can get some free modules.
yes.
Okay.
As far as I remember, it's not too much.
Hmm.
It's not very expensive. Maybe like 10, 20 pounds for tops.
10, 20 pounds per topic or in total?
I think it was like monthly payments, maybe like 10 pounds.
Monthly.
I might be
Okay.
exaggerating. Yeah.
Okay, that's very good. Right. So this is for the like the free thing, and I showed you the curriculum here. Yeah. So let's go back to the presentation. So CBDs, 50 CBDs for your appraisal. Then there is another item you have to fulfill your achievements, what you've done, so far during the year, which would be obviously like the clinical cases, scenarios. It's a lot of writing. You have to reflect a lot on the appraisal and write everything you've done. Uh, Also, when you submit any CBD, like a conference or any online training or whatever, you have to write a reflection on everything. Don't just put the certificate and leave it empty. You have to write the reflection on it. Then you have to submit any incidents or complaints if you've been involved in them. If you're not, then just write, I wasn't involved in any complaints or incidents. If you've done an audit or a QIP, you also include that and put the presentation of the QIP or the audit as an attachment. I mean, on the appraisal website, there is a way to, like attach all the certificates and everything. It's very easy. As I said, signposted. Any teaching you've done, you just also submit there. Then at the end will come like a final page, which tells you if you have achieved everything according to the general medical council good medical practice, which includes 4 domains: patient safety, knowledge, information, and I can't remember the 4th one, but yeah, there's 4 domains. But in each domain, you just have to write something, okay? You can't leave it empty. After you finish all of that, so that can take you, obviously you prepare for your appraisal during the year. So don't do your appraisal if you don't have your CBDs, because there is no point to do that. After you fulfilled your CBDs and you collected all your 50 external and internal CBDs, then you write all of this and you submit it to your appraisal. The appraiser, you can choose either someone from the hospital or no, I don't mean the hospital. I mean, you need to choose someone from the hospital, but you can choose someone from the department. It's only me at the moment, but you can, there are like 120 appraisers all over UHB. So you can choose anyone and you ask them, obviously you send them an email, see if they agree to be your appraiser or not. I'm happy to do your appraisals, but I need time. Okay, so you can do one per week, but it's very difficult to do everyone in the department, especially like 90% of our doctors are non-trainees. Right, so this is your appraisal and your portfolio. Any questions, guys? I think for the ITF, you already have an appraiser related to an UHB. You go there and they do your appraisal. Is that right?
Also, can I add a quick add, or maybe actually a question? I'm not 100%
Yeah.
sure. I think the CBDs, so the hours for the ALS, which is almost like 15 hours, I think it counts for the CBD, right? Or
Yeah,
does
yeah,
it?
yeah, true.
Okay.
That's
Yeah, because this will be a
yeah.
quick
Thank you
win.
for adding that.
Yeah.
Yeah,
Yeah.
that's very useful. Yeah.
Hi, Dr.
Yes, Chai.
Joseph. So about the case-based discussions and mini cakes, how many do you expect from a trainee or even non-trainee within a year, if he or she is your trainee?
You mean for the many kexes and CBDs and ACATs? Or what do you mean?
Yeah. So how many? What is the number you expect?
In the
Yeah,
portfolio?
trainee
Oh, portfolio
CAS,
total,
ACATs, and CBDs.
you need a total of 10 SLEs. They call it SLEs. 5 of them should be ACATs, and the rest will be many kexes
Okay.
and CBDs. And DOPSs are a separate entity because it's separate. So in total, because the 5 ACAT will have, each ACAT will have minimum of 5. So that's 25 plus, 5 CBDs or CBD or many kexes. So that's in total 30 cases.
Okay, so that's for a year.
For the year, whole year, yeah.
Thank you.
Welcome. Any more questions?
Sorry, doctor, I just want to ask about, can I use the CBDs I used in portfolio, same one on appraisal for?
Yeah, same thing.
So just a different form, but with the same
But
thing.
There is a difference, as I said, between CBDs, which is continuous progressive something, or no, personal development. This is more related to attending conferences and online teaching and that stuff. But the other CBDs in the portfolio are cases. Okay. But you can use them in the appraisal, saying that you have spent this time writing them. Okay, do you get me? Not you can't use the CBD itself as part of the external CBDs. There's a
Okay.
difference.
Yeah.
It's
Thank you.
more for training application. If you want to apply for an IMT, you want to apply for a GB training, your portfolio should include all the cases you've seen, because it means you know all these cases.
Okay, doctor.
All right, guys. Right, I think we'll have to finish here. I will try if my recording works to send it also in the group for people who couldn't attend, because I think all of you need to know how to submit your portfolio and appraisal. Okay, so thank you very much, and wish you a good night.
Thank you, Dr.
Thank you.
Musab.
Thank you, Dr. Musaf.
Thank
Thanks
you.
a lot,
Thank you,
Dr.
Dr. Abhishek.
Thank you.
Bye.
Thank you, Dr. Musaf.